Hi there, Holly. What was up?
Hi, Joe. Thank you for seeing me on such short notice.
Have a seat, please.
I've been constantly feeling down and upset, which is affecting me at work. The doctor had diagnosed me a few weeks ago with depression, but I really don't think I have it. Could this create difficulties for my employment with the bank?
Absolutely not. In fact, we are able to accommodate employees with these possible illnesses. Do you want to know more?
Sure.
Well, psychiatrists describe depression to be a period of time when one has negative feelings of worthlessness, hopelessness and helplessness. All people have a period of unhappiness during some point in their life, but for some it may be extended. If the mood continues in this way, it can begin to interfere with the everyday life and could become a serious depression, for which professional assistance can be provided.
That sounds like how I feel. What causes depression?
There are a lot of causes for depression. Some of the major reasons are family members' death or illness, poor self-esteem, seasonal body adjustments and addictions.
There have been cases of depression in the past within my family. Could it be hereditary?
Yes, in fact, according to research, there is evidence to support that depression has relation to family genetics.
I heard that depression isn't limited to one type, and that there's many forms of it. Is this true?
Yes, depression is a general category for multiple mood disorders. Some of the most common types of depression affecting individuals include postpartum depression, seasonal affective disorder, anxiety depression, and atypical depression. However, it's not only limited to these types.
Can you tell me more about each of them?
Well, firstly, postpartum depression affects women after pregnancy. It could create major depressive episodes for them and cause a lack of attachment to their newborn. The duration of this type can largely vary for each individual. Another common type of depression is seasonal affective disorder, or better known as SADS. It's a recurring disorder which affects people during specific times of the year, usually in the fall or winter. The change of seasons can severely inhibit them from completing daily tasks as well as performing efficiently in the workplace. In many cases, anxiety is a common occurrence of individuals suffering from depression. It is not a form of depression itself, but rather a symptom. They may suffer from panic attacks on a frequent or infrequent basis, which may be caused by stressful situations. People with anxiety might have phobias of things like crowds or even social interaction.
What if I oversleep most nights and feel as if I've gained weight? Or I have a loss of appetite and feel sensitive to rejection? But then I find positive events to make my mood better. My expression will be happy-go-lucky and change. Does this count as depression?
This can happen to people with specific types of depression, such as atypical depression. People with atypical depression may find positive events to boost their mood. However, they face a number of symptoms with this form of depression. This is important because it creates infrequent depressive episodes for workers. Ask your doctor for more info.
Outside of a doctor, how can the bank accommodate workers with my condition?
There's a bunch of ways to accommodate people with depression. We don't give preferential treatment to employees with any illness, but we believe to give everyone an equal opportunity. One way the bank accommodates all employees is to ensure the environment is accepting of all workers by addressing their individual needs. This might include scheduling changes or decreasing workloads. That way no one feels uncomfortable while they're here, and reduces overall stress, which is a common issue of people who suffer from depression. We know that depression might affect people during various parts of the day. Because of that reason, our standard policies might require flexibility for these people. You can get additional breaks if you need them. Or some employees are required to leave a bit earlier to avoid crowds on subways and buses. We can accommodate this by letting them leave 30 minutes earlier.
That's good to know I have some help. But what about job reviews?
Your managers can provide job coaching or separate job performance reviews to help ease stress or depressive episodes better. We understand that career development is important and want to tailor it differently to everyone.
That's good to hear I have this kind of backing. But how does assisting us help the bank, Joe? I think it's kind of a hassle for everyone.
Well, there's been research that if a company has happier workers, they'll be more productive overall. It has also been found that healthier workers make fewer errors, which means we work better as one. Although we want to accommodate you the best that we can, no one wants you absent too often. Without you, it can affect the whole team. It's costly to have you absent or to let you go completely. That's why if we can accommodate to all our workers, they will also be more committed to their jobs and to us.
But sometimes I feel that I might be limited in terms of my performance because of the symptoms I face. It also makes me feel embarrassed. Do I have to tell anyone?
We know that many people may want to keep their condition private, and any accommodations we offer are completely optional for employees to take advantage of. Anything reported or documented must stay confidential with us.
Joe, would you say that depression is considered a disability?
Yes, it is, since it restricts the amount of major duties you can perform, such as self-care, working, and even learning. By the way, Section 15 of the Canadian Charter of Rights and Freedoms removes discrimination against you. This section gives everyone the right to be treated equally before and under the law. Also, it includes equal benefit without discrimination based on any mental or physical disability. Since depression is called a mental disability, you have full rights to be treated just as equally as the other workers despite your disability.
Oh, really? I had no idea there were any legislation protecting people with depression, let alone be even considered a disability.
Well, of course. Depression is pretty common. Stats Canada found 13 to 14 million people a year will experience a depressive disorder. Like I said before, depression is considered a disability and there are a lot of legal aspects protecting people in the workplace. The other piece of legislation is the Ontario Human Rights Code, which defines disability as a degree of conditions. In some cases can be seen and some cannot, like yours. This code protects discrimination from disability in the past, present and perceived conditions.
Oh wow. I feel a lot better that my condition's recognized by the bank.
Of course, we care about you and anything you are going through which is affecting your daily life, especially something as big as this. The Ontario Human Rights Code is important for you to know about since it covers equal rights, opportunities and the freedom from discrimination. The code says that all workers with disabilities must be entitled to the same opportunities and benefits as other workers and also have special accommodations given to them to complete their duties in the workplace. That is also why we want to help you. It's in our best interest to always protect your rights as an employee here.
Well, that's great that this is across all workplaces in the province. I'm pretty satisfied with the info you're giving me. Last question, for the future, could there be any barriers to employment due to my disability that I should be aware of? Let's say for another employer in the future.
Well, any sort of psychiatric disabilities are considered a barrier itself since a mental illness can be identified as cognitive, perceptual and affective difficulties. This is why special accommodations are needed, but an employer can't restrict you from being hired for having depression. You might want to let them know later. We also understand if you are taking any medications, they can cause side effects which might affect you at work. So Holly, this means that if you have any sort of arrangements you would like to make with us if you start noticing any issues with side effects from your medication, just let one of us know and we have you taken care of. Make sure you keep us updated so we know what's going on.
Oh, I didn't know side effects could happen. I'll for sure let you know if any meds cause issues for me.
Does all that info help you out a bit more, Holly?
This makes a huge difference. Now I don't feel so out of place. I really appreciate you taking a few minutes and better explaining this all to me.
Not a problem.
I'll get back to the desk now. See you later. Thanks again.